Good morning. This is Dr. Suhas Haldipurkar. I'm an ophthalmologist practicing in Panvel. Intraocular lens implantation is a part and parcel of cataract surgery. Like today, when you get operated for cataract, it is understood that cataract is replaced by an intraocular lens. Intraocular lens is made of an acrylic material, and it is either a non-foldable or a foldable. But today, because most of the cataract surgeries are done using phacoemulsification system, and it is done through a very tiny opening, and that opening ranges from 2.2 to 2.4. Naturally, a lens that is implanted inside has to be a foldable lens which is injected into the eye after the cataract surgery. So normally, an intraocular lens implant is either a monofocal lens or a multifocal lens, or today we have trifocal lenses. When we say trifocal lens, that means that lens is able to focus at near, at an intermediate distance, and at infinity. And now a newer category of lens that has come, which is called an EDOF lens, or an extended depth of focus lens. That means that lens gives you a focus at an intermediate distance, or at an infinity, or from intermediate till the infinity. So you'll ask me, what is the difference between an EDOF lens and a trifocal lens? A trifocal lens gives you distinct foci at different places, whereas an EDOF lens gives you a focus from intermediate distance onwards till infinity seamlessly. Now, all these lenses, once they are implanted, they normally stay in the eye without any issues, but they still need to be checked maybe after 6 months or on a yearly visit. The reason being, after the cataract surgery, there's a condition that happens that's called after cataract, or capsular opacification. So once that capsule in which the lens is put, it develops some opacities, the vision starts dropping down. And if you notice that and the vision has dropped significantly, then with laser those spots can be cleared. It's called Capsulotomy. And so we advise our patients after the surgery as a routine to come for a regular follow-up, because it is in the best interest of maintaining the good vision for a long time.